if it would help fight tooth decay. The health implications of adding fluoride to water have been examined in a new report from Public Health England, which is out later this morning.
Currently, about 5.5 million people living in England get fluoridated water to help protect against tooth decay.
It's mainly added to water in the West Midlands and part of the North East.
Birmingham was the first city to add fluoride to water on a large scale in 1964.
Well, with us now to discuss this, Professor Damien Walmsley, a scientific advisor to the British Dental Association, and from our Tunbridge Wells studio, Professor Stephen Peckham, who's campaigned against the fluoridation of water. Good morning to you both. Damien, let me start with you. I can remember my parents talking about this when I was a child. Half a century later, we still haven't resolved it. Why can't we get this sorted out?
Well, we have resolved this in Birmingham. Birmingham's got the fluoridation, and you mentioned Newcastle as well, and we're enjoying the benefits of it in Birmingham. For the last 40 years, we're coming up to the 40 years of it. So parts of the country are enjoying it.
You say enjoy the benefits. For people at home, what benefits?
Well, the benefits makes a tooth stronger. We know that. It makes a tooth stronger, and it also... One of the problems is if you eat sugar, the bacteria turn the sugar into acid, and it's the acid that actually dissolves the teeth. The fluoride actually tips the balance to keeping the actual mineral in the tooth. So it has a couple of ways of doing it, making the tooth stronger, and it also helps to keep the mineral in the tooth.
All right, Professor Peckham then, if the benefits have been so wonderful to people of Birmingham over the past half century, why are you still arguing against it?
Well, I think the evidence doesn't show that conclusively that there are substantial benefits in either the West Midlands or in the Northwest. And for example, in the Northeast, areas with similar levels of deprivation, Northeast, without water fluoridation have similar levels of decay. And across even the West Midlands, there is still substantial variation in the levels of decay in children. I think the main problem is that we know that fluoride is very, very effective when applied to teeth. There's extremely good evidence to show that toothbrushing is very effective at dealing with dental decay. That the evidence on water fluoridation is much, much more controversial and far more suspect, with very limited demonstration of any benefit at all. And if there is, it is extremely small.
And you say controversial. What, are you concerned that there are perhaps dangers if water is fluoridated?
Well, recent studies, survey from the European Scientific Committee a few years ago, demonstrated that for children drinking more than, say, a litre of water a day in a fluoridated area would exceed the recommended level of fluoride intake in one day. And I think that is extremely concerning. I mean, the most obvious problem relates to dental fluorosis, which is normally dismissed as being something which is not and shouldn't be of concern. But the evidence from places like Ireland and the USA show that levels of dental fluorosis are now something like a third or even 40 or 45% of children, with some children having their teeth damaged by over-ingestion of fluoride.
So, Professor Walmsley, the case of the benefits not entirely proven, and could it be doing more harm than good?
Well, I'd take on the benefits not entirely proven. There's a recent article in the British Dental Journal that showed that accident and emergency admissions, and we're talking about children who have toothache, it's a very distressing, very uncomfortable situation if you've ever had a child who's had that. And one of the things is that we found, that there was a study that was found, that in Liverpool, 27 times more people are going to have emergency extractions done in the hospital than in the West Midlands.
I think that's fluoridation, though, surely.
Well, they linked it between
people don't brush their teeth as much in some parts of the country. For instance.
Well, Professor Peckham talked about brushing teeth. It's about getting the fluoride and targeting it to people. And there's a lot of inequalities in the country. And fluoride is a really safe, cost-effective way of getting it to those people.
Okay, let's put that to Professor Stephen Peckham as well. A cost-effective way of making sure that some people who wouldn't be reached are.
Well, it's not necessarily cost-effective. I mean, in southern Hampshire, the NHS has spent hundreds of thousands of pounds trying to implement a fluoridation scheme. And actually, they haven't even achieved that. And that money could have been spent on much more effective schemes. And just a point about the recent British Dental Journal study, if you just take hospital statistics for general anaesthetics, you're actually misconstruing the data. A lot of data on extractions isn't included in those hospital statistics, and really what you're doing is basically you're counting one thing and saying that the relationship is something else. So if we look in Scotland...
Very briefly, if you would, Professor, because I'm terribly sorry to interrupt you, we're out of time there. This debate's been running for half a century, and I think it's going to run for a lot longer. Professor Stephen Peckham, Professor Damon Walmsley, thank you very much.
Thank you very much.
Lots of you as well in contact. Andrew says tap water should be clean and safe, that's it, no extra chemicals should be added. People should not be forced to consume chemicals they don't want. Some of you, though, would like to see it in water.
12 minutes to 8.